Hi, Mike and Arlen, our Philippine journey. Healthcare in the Philippines, part two. Great. You know what? We're going to finish up the hospital side today, and we're going to tell you a couple of different things. First one is exactly how do hospitals in the Philippines bill? What are the requirements for you to pay that bill? And how do they implement that? And then finally, we're going to compare that to what you're used to in the U.S. and some other countries that have government-sponsored payers. So here we go.
I never got it, why'd you have to go? I guess this world's too slow for you. I think there's beauty in the gray, the cold, but you just want the gold. And there's no way I can beat it, cause I got no chance when it comes to her. She got the glitter and the fame, and I just wasn't enough.
All right. In the U.S., hospitals, ambulatory centers, and many other healthcare institutions utilize what's called DRGs, and all the insurance companies utilize DRGs. I wonder what that is. A DRG, a diagnosis-related grouping. This came into play in the late 80s and then went system-wide. And essentially what that is that if you get admitted to a hospital or if you go to a hospital, the first thing that happens is you're assessed and then assigned a DRG. That DRG will maintain how you're treated, what you're treated with, but it also maintains how it's paid. And this is where it's different than in the Philippines. Okay? Now, the Philippines does use DRG, some hospitals do, and they also use ICD-10 CPM coding. That being said, what happens and let me give you an example, what happens in the U.S. In the U.S., you go to the hospital, shortness of breath, cough, whatever, all right, you're assessed. That assessment would be assigned maybe a DRG, depending on your symptoms, initial blood work, and maybe a chest x-ray, pneumonia. You're admitted to the hospital for pneumonia. Blue Cross Blue Shield, Kaiser, doesn't matter, your HMO, your PPO, all of them. They're going to have contracts with the hospital to provide payment based on DRG. And what will happen with the hospital in the U.S. is it's going to pay, it's going to follow a criteria that is set for that DRG. So here's one that I can remember offhand is delivery of a baby. The DRG for delivery of the baby is going to include labor and delivery room, nursing, supplies, and I think it's 2 days for normal delivery in the U.S. And it's going to pay that amount. All right. It has a contract with the hospital that it's going to pay that amount. In turn, it's also going to have a contract with the physicians. Because remember, in the hospital in America and in the Philippines, hospital is a facility, so there's a facility charge. And then physicians are physicians, and there's a physician charge. So your insurance company is going to allow X number of dollars for the treatment. And the way hospitals make money is providing that care within a budget. They're on a budget. You're on a budget. You may not realize it, but you're on a budget. And for them to go outside of that DRG, they have to come up with a reason to incorporate an additional DRG. So for instance, let's say you go into the hospital, you have surgery, you develop an infection, there's a DRG for a nosocomial infection. That extends the amount they get paid, the number of tests they can do, or what the hospital's willing to do that are going to be within that payment scheme. In the Philippines, that's not the way it works. And we're going to give you 2 examples in the Philippines about how that works because we've experienced them personally. One, a private hospital setting, one, a public hospital setting. Now, Arlene's father developed internal bleeding. I'm not going to go into it. Let's just say he developed a GI bleed, and we had to get through that. The billing for that was almost identical in respect to how it was done at both, because he started in a public hospital and then we put him in a private hospital to get it done. You're going to get billed for everything. It's a line item billing. Okay? Every aspirin, every 4x4 gauze, every 2x2 gauze, every needle used to draw your blood, all right? Every test that's run, you're going to get charged a nursing fee. In addition, you may even get charged an ancillary employee fee, which would cover like the person that actually keeps your room decontaminated and the person that nurse's aide that assists the nurse. You're going to get charged for every single piece of it. All right? We got the line item billing from both facilities. They pretty much followed each other. The markups are absolutely atrocious, but it's still way cheaper than in the U.S. Okay? Now, what also happens is that when you get charged for this stuff, how do you pay and when do you pay? Okay. So there's always been a lot of talk about they can't keep you in the hospital or they won't let you leave the hospital until you pay. Well, let me tell you, I will look for it. I will put the link below. Here's how it's supposed to work. And if it doesn't, there's a lot you can do about it. If you go to the hospital as an emergent patient, okay, and you get treatment to stabilize you. Treatment to stabilize. Now, this is not going to the hospital because I don't feel good or anything like that. This is going to the hospital as an emergent issue. In the Philippines, they cannot hold you in the hospital for stabilization. So you go to the hospital, you get stabilized, okay? You don't have to pay Johnny on the spot. Now, they're going to pressure you. We've seen this, and we experienced it. They're going to pressure you to make a commitment to payment. They're going to pressure you to set up a payment plan. They're going to do this. They're going to make it as miserable as possible for you to get out of there without paying. And they're going to always play that trump card of you can't leave until you pay your bill. You better make some phone calls and bring somebody over. Where this difference is, if you go to the hospital as an emergency and you want a private room, it's like checking into a hotel. Now, it's all mandatory. And for that a la carte type service, once you get that private room, even if it's stabilization, you must pay before you leave at most hospitals. Okay? And the link that I'll give you, because I'll look it back up, the link that I give you specifically states this is the way it is. All right. This is the billing mechanism. This is the Republic Act that actually defines how payments made. Okay. Now, that doesn't mean you have to pay the doctor's fees before you leave, unless the doctor is a staff physician, then it's a hospital bill. So that's the difference. So you need to be aware of this kind of stuff before you go to the hospital. That's why we tell people, look, be prepared. You've got to be prepared, and you've got to be an informed consumer. And that's really all it is to it. I mean, we can tell you all there is about hospitals, but quite frankly, most expats, unless you live in one of 3 major cities here in the Philippines, your hospital selection is somewhat limited. So you only have able to do the best with what you have. Don't complain. That's the way the country is. All right. You can't change it. Can't be done. The final thing I want to point out is the difference between American hospitals and Philippine hospitals with respect to money. In America, hospitals, county hospitals, all right, public hospitals, things like that, very large number of hospitals are not-for-profits. Okay? I hate that because it's such a lie. Here's what happens. You go to the hospital and you get a 3-cent aspirin. The hospital charges you $5. Now, your insurance company is only going to pay maybe 40 cents or something like that. But if you don't have insurance, you're going to get hit for that full $5 because you're not with anything that has a discounted program. And that includes Medicare. Now, let's say you have treatment, and you end up, even with insurance, owing 10 grand. Okay? You had a bypass. Bypass is going to still cost you more than that. But let's say you had a hip replacement. You're going to still owe, between $3,000 and $5,000, depending on your insurance company. All right. And let's say you don't pay it. Well, that money that you don't pay, the hospital gets to write it off. They're the only company, that's the only type of organization in the U.S. where your accounts receivable are a 100% write-off, top-line write-off. All right? And then what the hospital does is they put that write-off into charity work. So the hospitals can spend as much money as they want, which is why they have super inflated compensation for numerous individuals at that hospital. Okay? The Philippines, it's not like that, to the best of my knowledge. All right? I researched this a long time ago, many years ago, and it was not like that. They can't write that off their bottom line in an inflated position. They may have other ways of doing things, but that's not the way it actually works. Physicians cannot do that in the U.S. They're not able to write that off as charity work and keep going. So that's why hospital billing in the Philippines is a little bit more upfront, because they know they're not going to be able to show and bill people and put them under a financial debt that is just absurd. Now, it's still very high for the normal Filipino. I mean, a normal appendectomy here is for a non-insured individual is really a life-altering expense for a Filipino. So this is how hospitals kind of work their billing and their DRGs. In America, it's much different. And if you guys want to, let me know in the comments. I really want to hear about it. But if you want to, let me know if you want a video that goes further into depth in that section. I don't want to really do it because it's so boring for a lot of people unless you're analytic and you just want to know. But if you want to, I'll make a video about it because I find it interesting how a non-informed consumer can easily get ripped off in both the U.S., but not only that, here in the Philippines. So our suggestion is that when you move or decide to move to an area here in the Philippines, make sure, number one, you have a fund set up for emergency hospital care and normal medical care. But not only that, make sure you understand how everything works when you get admitted to a hospital. That's the most important part. Look, if you found this a little bit interesting, great. Please subscribe. If you just appreciated the effort, please subscribe and hit that thumbs up. Otherwise, now the next one we're going to go into is going to be physicians. And this is where you're going to have a little bit more leeway. And this is where being an informed consumer makes a huge difference. Okay? Thanks. Have a great day.